Hello, in today's video we are going to demonstrate how to check capillary refill and then how to use the pulse oximeter. These two things are done when taking one's vital signs. Capillary refill shows how well the tissues are being oxygenated. That is, there's adequate supply of oxygen in the various tissues in the body. In a light-skinned person, the skin should turn pink when testing for capillary refill. But then in a dark-skinned person, due to the melanin deposits in the system, on the skin surface, it's quite difficult. So you notice the color of the nail beds, the oral mucosa, and then the lips to check for oxygenation of the tissues. So capillary refill helps to identify problems with oxygenation. The normal test period is between 2 to 3 seconds. Should the capillary refill test be above 3 seconds, immediate response should be taken to the patient, and then the nurses and those in charge should be informed.
Permission is being sought and vital signs is taken.
And then using the pulse oximeter, these processes are done during vital signs taking. So you'd have to ensure that the hygienic processes are ensured and then privacy is being done. So with your hands washed, you then inspect the nails of the patient to notice coloration or pigmentation or any inflammation, or maybe there's signs of clubbing. And then you then blanch the nail bed for some few seconds and then release. So it should turn, when you blanch, it turns white, and then when you release, it should return back to its normal color within 2 to 3 seconds.
This period is said to be normal.
Pulse oximetry is a simple and painless test that is done to determine how well oxygen is being supplied to the cells in the body. Hemoglobin is part of the blood, so it carries the oxygen. The pulse oximeter measures the amount of blood that are oxygenated and it converts them to a percentage. It measures how full the hemoglobin molecules are with oxygen. So in checking pulse oximeter is to check the saturation level of the oxygen in the blood system. It could be continuous or intermittent in the measurement. For a person in critical condition, the pulse oximeter are placed in situ for a very long time just to monitor the saturation level of the oxygen. But then for someone who is just coming for a normal checkup or is coming to check how well he or she is, the pulse oximeter is placed in between 10 to 15 seconds. With the pulse oximeter, we have the portable ones and then the ones that are connected to the vital signs monitor that are mostly seen in the intensive care unit. So it has sensors and then it uses light in reading the oxygen level. So first, you carry out the procedure by assembling the pulse oximeter equipment, and then you ensure that your hands are washed and sanitized. You also check the patient's fingers to see if it's dirty, signs of cyanosis or clubbing or inflammation, or if there's a tear. And then you should also check if the nails are long, because if the nails are long, it could interrupt the readings from the sensor. And then if the person has bad polished nails, it could also interrupt the readings, since that can affect the sensitivity level of the pulse oximeter. So with your pulse oximeter and your patient's nails clean and sanitized and having short nails, you either place it on the thumb, the index finger, or the middle finger, whichever way. You should also have an adhesive tape should the area in which you would input the finger needs a little bit of adjustment to ensure that the sensors are reading as it's supposed to be read. So then you select and apply the sensor. So I would use the thumb, and then so with the pulse oximeter in the finger of the patient, and then the sensors at its appropriate places. Some pulse oximeter come with markers to enable one to put the person's finger at the right location. If not, you use your discretion and then you secure it with an adhesive tape if needed. The pulse oximeter peeps, that is in relation to the heartbeat. So you could be checking the pulse of a patient to check to see if it coincides with the readings of the pulse oximeter. So the highest reading is marked for the period of 5 seconds. So you monitor the patient's respiration as well as general appearance whilst this is being taken. So as I said earlier, the pulse oximeter and then capillary refill time are done during vital signs taking, and then you'd record your values into the patient's chart. Per each recordings would give you a variation of the person's condition. So the patient I had SpO2, that is oxygen saturation, was 99% and the pulse was 68 beats per minute. The capillary refill time was 2 seconds.
With a reading 99%, it means it's normal. The percentage read from the pulse oximeter corresponds to the patient's condition.
When done checking the vital signs of the patient, you thank the patient for her cooperation. You then wash your hands and then you inform your supervisor with your details.